Okay, hello everyone. Welcome to our video discussion on medical nutrition therapy for pulmonary diseases. This involves diseases that happen or that involve the organs of the respiratory system. Of course, we had already a discussion on some of the diseases involving the respiratory system, especially in those parts in the upper respiratory system, and those are infections, diba? Infections involving um, the upper respiratory tract. And yeah, we also already discussed the MNT for COVID-19, which affects the lungs. In this video discussion, we'll discuss the rest, especially the those chronic diseases. So meaning those diseases that are long term, that affect the respiratory system chronically, and of course the implication of those diseases on the nutritional status of the patient, okay, and vice versa. Okay, so malnutrition is very common in pulmonary disorders, especially in chronic pulmonary disorders. Okay, and malnutrition affects the functioning of the respiratory system in many ways. Like malnutrition impairs respiratory muscle function, malnutrition impairs ventilatory drive, malnutrition actually reduces the body's response to hypoxia, and also the malnutrition also negatively impacts the pulmonary defense mechanisms. Okay, so dili na kaayo competent or maayo ang function sa mga muscles that are found in the respiratory system, so therefore negatively affect ang respiratory function in such a way nga mo decrease ang breathing rate, or mo decrease ang amount of oxygen nga ma-inhale, or ma-reduce ang amount of carbon dioxide nga ma-exhale. Okay, so those are disturbances, those must be avoided dapat. But when malnutrition is present, those disturbances would really likely to occur, because that's the effect of that's the negative impact of malnutrition. Okay, so it reduces ventilatory drive, and the body would not be able to resist hypoxia as competent as in a healthy body, diba? What is hypoxia? Hypoxia is actually the reduced oxygen perfusion into the cells, and of course that is caused by reduced oxygen uptake by the respiratory system. Okay, dili maayo of course nga walay oxygen atong lawas, because of course that without oxygen we can just die in a few minutes, or even in seconds lang if walay oxygen. And that oxygen is very important, especially in maintaining the ATP levels in the cells, such that if magkulang ang ATP generation, that's fatal. Okay, so that's why naay mga instances guys nga magkulang gyud ang amount of oxygen nga mosulod sa cells, but naatay mga mechanisms to actually resist that in a healthy body, but if someone has already malnutrition, then they cannot respond as effectively as healthy humans do. Okay, so that's one of the many negative effects of malnutrition. Okay, effects of malnutrition in patients without lung disease. Okay, the respiratory muscle strength is decreased by 37%, maximum voluntary ventilation is decreased by 41%, the vital capacity of the lungs is greatly decreased by 63%. Okay, diaphragmatic muscle mass is decreased to 60% of normal in underweight patients who died of other ailments. Okay, so yeah. But what about in those with pulmonary disease already? Decreased cough and inability to mobilize secretions, atelectasis, and pneumonia, and prolonged mechanical ventilation and difficulty weaning with prolonged ICU stay. Okay? So, that's why very important no nga i-maintain ang nutritional status sa patients with pulmonary disease kay mo decrease yun ang quality of life sa patient. Diba? Maglisod siya ginhawa, maglisod siya pagawas sa phlegm, sa mucus nga nag-accumulate dito. And lisod ang life kung magsigila kag ubo-ubo, diba? You have probably experienced that sa una kung naamoy asthma no or kung grabe yung ubo sa una, diba lain kayong feeling nga kanang sigira kag ubo, diba? It really, decreases the quality of life. So, by maintaining the nutritional status of the patient, no, naadi ay na siya positive impact sa, sa pag excrete sa excessive excessive phlegm, no? Okay? And what does atelectasis mean? Diba? This is similar with pneumothorax, no? Okay? That's collapsed lungs. Diba? And atelectasis is actually very dangerous, no? Okay? So, when someone has malnutrition, atelectasis incidence is higher. Okay? And also the onset of pneumonia, no, which is also very dangerous. Okay, what is the severe form of COVID-19, diba? Many COVID-19 patients who developed severe COVID-19 had pneumonia, diba? And that's the reason that actually that's one of the reasons no nganong mamatay sila from COVID-19 due to pneumonia. Okay. Prolonged mechanical ventilation. Okay. If someone is critically ill, usually mechanically ventilated po siya, meaning na-intubate. Diba? Intubated. Okay. Mag-depend ang iyang breathing function sa machine, which is, mechanical ventilator. Diba? That's the machine that where we base the computation for TR using the indirect calorimetry method, diba? And that's a life support, diba? That's usually present in the ICU. Okay? Because in many instances, such as for example, the patient has developed COVID-19, severe COVID-19, magdepend siya sa machine, no, for the breathing function. So if the patient is malnourished, then that is associated with prolonged ICU stay. So mas dugay no ang stay sa ICU, and that means more hospital costs, diba? And poorer prognosis, diba? And many studies have shown that if someone is malnourished and is mechanically ventilated or is intubated, no, then that patient is or experiences more difficulty weaning from the machine. Okay, when you say weaning, pag-undang, di ba? When someone is recovering from this kind of disease, no, that impairs the breathing function, one of the signs that the patient is recovering is independence from mechanical ventilation, or kanang di na siya mag-depend sa mechanical ventilation. Okay? But if na siya malnutrition, then maglisod og kanang extubate, or maglisod og kanang remove sa mechanical ventilation. Okay? So that's why malnutrition must really be emphasized and must really be prioritized in the management of these diseases, no, because nutritional status has this big impact on, on the recovery of the patient. Effects of malnutrition in patients with pulmonary disease. So altered host immune response and cell-mediated immunity contributes to chronic or repeated pulmonary infections, decreased surfactant production, decreased lung elasticity, and decreased ability to repair injured lung tissue. So these are also the effects now of malnutrition in these patients. Okay, the patients would be more immunocompromised. And if someone with pulmonary disease is immunocompromised, then they are more, they have more chances of developing cytokine storm, and that's usually the precursor of ARDS, or acute respiratory distress syndrome, which is also one of the causes why many COVID-19 patients who develop severe COVID-19 die. Okay? You also have to review the organs in the respiratory system. So we have the of course the windpipe or the trachea, and then we have the bronchi, and then the bronchioles. The bronchioles are those smaller branches that branch out from the two bronchi. Okay? Kani. These are the bronchi. Duhara man ang bronchi, but ang bronchioles daghan. Kaning mga mini branches. Then, the functional units of the lungs are called alveoli. Diba? So, this is where gas exchange occurs. Okay? This is where oxygen is, is inhaled, and this is also where carbon dioxide is exhaled. Okay, or diri lagi ang exchange of gases mag-occur, no, okay, sa alveoli, and there are hundreds of alveoli. Okay, kani these are called alveoli, no, and this is the kung i-zoom in na nimo, then diri mahitabo ang gas exchange, di ba? Oxygen in, carbon dioxide out. Okay? And these are the bronchioles, kaning mga gamay nga mga branches. Then ultimately mag-form na into the two bronchi, and then of course mag-meet na sila sa trachea. Okay. This is an oversimplified anatomy, no, of an alveolus. Alveolus is, the singular term for many alveoli. Okay. Inani siya, elastic siya, and dili siya inflamed, and relatively large lumen, no? When you say lumen, of course, kanang bangag, di ba? That is where, the gases travel. Okay? Travel through. Di ba? And kani siya, mao ni siya ang kanang mga muscles, no, that that are responsible for the elasticity of the alveoli. Okay, it's very important, no, that your lungs, especially the alveoli, are elastic, no, because kung di kayo na siya elastic, then maglisod ta ginhawa. Okay, very important pud nga dili siya inflamed or else maglisod pud ta ginhawa. Okay? And mo na siya usually, for example, sa COVID-19, nganong kuan man, nganong maglisod man na sila ginhawa, no, due to the inflammation mo baga ni, no. Okay? Tungod po na siya sa immune system that had gone into an overdrive, no, and nagka-produce sila og mga cytokines which damage the healthy lung tissues, and that's usually the end game, no, of those patients who develop severe illness. Okay, so this is what happens, no, if someone has chronic bronchitis, asthma, or emphysema. Okay, in chronic bronchitis, as you can see, gamay na lang kaayo ang lumen, no, then naay inflammation nga gakahitabo kay kani ni baga siya, no? Okay, so if you can just imagine, no, maglisod yung kaginhawa ani, kay hapuon yun ka. What about asthma? Naaya pon inflammation pero mas disordered siya, no, compare sa chronic bronchitis. Then wala lang gipakita diri na ani mga phlegm diri or mga excess mucus. Okay, emphysema, dili maayo, naay mga fibrosis, naay mga scarring nga gakahitabo. Okay, so later I will discuss, no, the etiology of this airway disorders. Sige, let's start discussing, no, the chronic or the long-term pulmonary disorders. We have bronchopulmonary dysplasia, cystic fibrosis, tuberculosis, bronchial asthma, chronic obstructive pulmonary disease or COPD. Okay, cystic fibrosis will not be discussed here because we will just tackle about this when we reach the hepatobiliary and pancreatic disorders kay affected pud to nga mga organs. Okay, for the acute pulmonary disorders, we have pulmonary aspiration, pneumonia, TB. Okay, TB can be chronic, it can also be acute, no? Okay, kani siya nga TB is acute, it's less than 14 days probably. Okay, or it's it would not take like many months, no? Yeah, cancer of the lung, acute respiratory distress syndrome or ARDS, and pulmonary failure. Okay, pulmonary conditions with nutritional implications. So okay, for neonates, okay, for the newborn, okay, ang chronic nga disorder, no, is BPD or bronchopulmonary dysplasia, and mao ni ato ang una i-discuss. Then for the obstruction, so meaning na ay some kind of hindrance or obstruction to the breathing function, we have cystic fibrosis, COPD, emphysema, chronic bronchitis, and asthma. Tumor, lung cancer. Infection, pneumonia, TB, COVID-19, diba? And all of those upper respiratory tract infections that we already discussed. Respiratory failure, neuromuscular abnormalities, okay? Naapod, no, nga involved po ang skeletal system like osteoporosis and scoliosis. Nga naman, how do they affect the breathing function? Usually, kung na osteoporosis, no, maglisod po, na siya effect sa breathing function, no? Okay, many of those who have osteoporosis are also, or they also find breathing difficult, no? Okay, and many of those who have scoliosis kay maapektuhan po ang alignment sa mga organs including the lungs. Okay, so that would also, scoliosis would also have an impact on the breathing function. Cardiovascular is pulmonary edema, so this is the accumulation of fluid in the lungs, no? And this is very dangerous. Okay, I will discuss this when we reach the cardiovascular system. Endocrine, we have severe obesity, which greatly impairs the breathing function, okay, due to the excessive fat accumulation. And Prader-Willi syndrome, okay, Prader-Willi syndrome is a genetic disorder, okay, whereby the affected is usually obese and has usually large food intake nga maapektuhan pod in many ways ang breathing function. Galis naapod mga respiratory issues, no, ang kani nga mga patients nga naay Prader-Willi syndrome. Okay, so we will discuss more of this, no, when we reach the metabolic disorders. So adverse effects of lung disease on nutritional status. Okay? So, kung kato ang effects sa malnutrition sa lung function, what is the vice versa, or what is the opposite? The effects of lung disease on nutritional status. So, increased energy expenditure. Okay. Taas yun, no, ang TR sa patient. Okay. Because of the coughing, di ba? Dako kayo nga energy ang kinahanglan to sustain coughing, di ba? Chronic infection, okay, yes, especially if infectious ang disease, no? That would also increase, as you know, the TR. And medical treatments that affect, no, the protein status, okay, like bronchodilators, chest physical therapy. Okay. And reduced intake due to inflammation, okay, due to anorexia, no? Fluid restriction, shortness of breath, if ang patient, no, kay di nakaginhawa, di na siya mukaon, kay kumukaon manggod na siya, mas samot nga di siya kaginhawa. Okay? Decreased oxygen saturation when eating, anorexia due to chronic disease, and GI distress and vomiting. So, if mutaas ang TR and mumubo ang food intake, so naayod imbalance nga mahitabo, and that would lead to weight loss and malnutrition. Okay? And usually, kaning mga chronic diseases like kaning sa COPD, usually naana sila kakeksya. Okay? Additional limitations, difficulty preparing food due to fatigue. They are also easily fatigued, no? Because of their disease. Okay? Lack of financial resources, impaired feeding skills, especially for those infants who have bronchopulmonary dysplasia, and also altered metabolism, no? Okay? Sige. So, yeah. Just like other diseases, kani mga diseases involving the lungs would also increase the energy expenditure, and the tendency is ma-reduce po ang food intake. So, na-imbalance, and that would lead now to malnutrition. So, the first lung disease that we will discuss is the BPD, or the bronchopulmonary dysplasia. So what is this? This is a chronic lung condition in newborns that often follows respiratory distress syndrome and treatment with oxygen. So this is characterized by bronchial metaplasia and interstitial fibrosis. This occurs most frequently in infants who are premature or low birth weight. So katong mga newborns, no, nga LBW, and katong mga premature, okay, katong gipanganak nga before sa term, okay, usually mag-develop ni sila BPD. So ang ilang cells bitaw ang cells nila sa alveoli mag-inflame, ang tissues ito mag-inflame, okay, and yeah, naapod mahitabo nga displacement of cells, no, like lahi nga type of cells ang nitubo didto, imbis nga the cells that are for the breathing function, lahi ang nitubo didto. That's metaplasia. Okay? Usually mahitabo na siya sa mga bronchioles, di ba? So the outcome would be dependence of these newborns, no, to a mechanical ventilator. Okay, di sila makaginhawa. Okay. Yeah, sa katong mga low birth weight nga patients, no, mao ni siya usually ang mahitabo sa ilaha. So signs and symptoms, hypercapnia. So there would be retention of carbon dioxide due to decreased lung function. Tachypnea, okay, wheezing, dyspnea, okay, recurrent respiratory infections, and cor pulmonale, okay, the right ventricular enlargement of the heart. Okay. And many of the effects of BPD in the infant is malnutrition. As if naman nga pag pag panganak nila, LBW na sila, di ba? Low birth weight. So, madugangan ang ilahang pagka-malnutrition. Okay? Kaya nga naman, di sila kaginhawa kaayo, and that would have an effect on their food intake. Like, di na sila ganahan mag-breastfeed. Okay? And, yeah, because this is an inflammatory disorder also. Okay? So, mutaas pud ang energy needs, okay, nga dili ma-meet due to reduced food intake or inadequate dietary intake. And they would also experience GERD, not GERD per se, no, but what's this, acid reflux, okay, and emotional deprivation and chronic hypoxia. Okay. So, magkulang yun ang cells nila, no, oxygen. And that would lead to growth failure. Kung kulang og oxygen, guys, sa mga cells, di yun na mo tubo. Kaayo ang bata, no? Okay? Kay, you know that very important ang ATP generation sa growth. Diba? Unsaon pag-produce og ATP dito if kulang ang oxygen. And you know that oxygen is needed for the macronutrients to be able to oxidize and ang ilang energy, no, ma-harvest, no, okay, para mahimong ATP. But if kulang ang oxygen, yeah, that would really lead to inadequate growth. Okay, so what are our goals in BPD, no? Okay, meet nutritional needs through many means. Okay, through several means, no? Yeah, promote linear growth, develop age-appropriate feeding skills, and maintain fluid balance. So, the energy needs in BPD is 25 to 50% higher than in age-matched controls. So, mas taas gud, no, ang TR sa kaning mga naay BPD compared sa katong mga healthy infants. So, babies with growth failure may have needs 50% higher. Okay, energy needs in acute phase is 50 to 85 calories per kilogram. And energy needs in convalescence, if, for example, kaning acute phase, no, usually kaning naka-intubate sila. Okay, but when they are recovering already, when they are weaned from a mechanical ventilator, then they are in convalescence or recovery. Okay, and yeah, mas mutaas pa gyud ilang energy needs, no, in convalescence to support growth. Okay, labi na nga naay nga ulahi na gyud sila sa trend compared sa mga healthy infants, so they really would have to catch up, no, and you know, the only way to do that is to increase the energy intake. What about the proteins within advised range for infants of comparable post-conceptional age? Okay, proteins are not necessarily or should not necessarily be high, no. Yeah, what I mean is that dili kayo siya nga taas gid kaayo. Okay, so yeah, katulang range nga similar, no, sa katong mga healthy infants. As energy density of the diet is increased by the addition of fat and carbohydrate, protein should still provide 7% or more of the total calories. Okay, yeah, so kung unsa tong protein requirements sa mga infants, mao gyapon to ilaha. Okay, how about the macronutrient mix in BPD? So, fat and carbohydrate should be added to the formula only after it has been concentrated to 24 calories per ounce to keep protein high enough. Okay, so fat provides essential fatty acids and energy when tolerance for fluid and carbohydrate is limited. Excess carbohydrate increases RQ and carbon dioxide output. So, carbohydrate should not be increased, no, Instead, the two macronutrients that should be increased are fats and proteins. Okay, it's very important, no, that carbohydrates is not excessive in order to prevent excess carbon dioxide production. And you know that an increase in carbohydrates would also mean an increased production of carbon dioxide. So to help these babies who already are experiencing difficulty in breathing, so might as well we will provide them a diet that would not make them overproduce carbon dioxide to ease their breathing function or to help with their breathing difficulties. Okay. What about fluids in BPD? Infants with BPD may require fluid restriction, sodium restriction, and long-term treatment with diuretics. Okay, especially if they are edematous. Okay, so check if the infant has edema, and depende po, no, sa level of edema, no. Okay, normally if na ay edema nga mild, ang sodium lang i-restrict, no. Okay, but if severe na, then both sodium and fluid are restricted. Okay. Use of parenteral lipids or calorically dense enteral feeds may help the infant meet energy needs, okay, despite of the fluid restriction that may be prescribed. Mineral needs in BPD, okay, these are individualized, no, okay, as since BPD is also an outcome of oxidative stress, so antioxidants might help. Okay, so those nutrients that are antioxidants might help, no. Okay. Interest in antioxidants including vitamin A for role in developing epithelial cells or to counteract the effects na of the free radicals. Okay, provide intake based on the PDRI including total energy to promote catch-up growth. Okay, yeah, so pwede ra nato i-base, no, ang ilahang needs sa PDRI. Okay, and look for the lab values, no, involving the serum levels of specific micronutrients, and see if the baby is deficient of that specific micronutrient. And you have to also take into consideration the formula that you are giving to the patient and see if that formula would be able to meet their needs. Okay, so you might want to increase it, or you just want to maintain the level of the intake depending on the results of your assessment. So what are our feeding strategies in BPD? Calorically dense formulas or boosted breast milk. Okay, depende pud, no, depende lagi pud sa status. Of course, if the baby is not meeting the increased energy requirements, then you might have to resort to monitor akong ginaingon nga mga means kanina, no, to increase their energy intake, like i-boost ang breast milk. This is one of the few times, no, nga breast milk can be boosted or can be altered. Okay, pwede nimo na butangan og other additives, no, just to increase the caloric and nutritional value of the breast milk. Okay, the doctor would also prescribe might also prescribe, no, a formula other than breast milk, no, just to help them achieve their increased energy requirements. Okay, a considerable portion of these patients, no, are also, under EN, okay, enteral nutrition. So small and frequent feedings, small and frequent tube feedings might also help, but many of these patients also can, take formulas or can take breast milk orally. Okay, so yeah, depende sa iyahang capacity. So long-term feeding problems in BPD, okay, history of unpleasant oral experiences, history of non-oral feedings, delayed introduction of solids, okay, discomfort or choking associated with eating solids, infants may tire easily while breastfeeding or bottle feeding. So if these long-term problems happen, intervention of interdisciplinary feeding team is usually needed. Okay? So that's BPD, guys. Okay? Mao ni siya usually sa infants nga mga premature, no? Okay, so let's proceed to another chronic lung disease which is called tuberculosis. So this is an infection. Okay? Especially karon, TB is making a comeback, no? And many patients are developing drug-resistant TB because of the, abuse in antibiotic use. Okay? The pathogen responsible for TB is becoming resistant to many drugs, diba? To many antibiotics. Okay? And TB is a fatal condition. Okay? Kahadlukan po na siya nga disease, no? Okay? Yeah. These are the nutritional factors that increase the risk of TB. Of course, that's malnutrition or decreased protein intake or decreased energy intake, no? And that would put the individual vulnerable, to infections because immunocompromised siya due to the presence of malnutrition. Okay? There is a debate whether it is a cause or consequence of the disease, but I think it's both the cause and the consequence of the disease. So this is part of the vicious cycle of malnutrition, di ba? Whereby malnutrition is both the cause and then the effect of the disease, di ba? When someone is malnourished, then mas dali siya ma-infect, mas dali siya makaka-catch up og infections, makaka-catch og infections, di ba? So in that case, malnutrition is the cause. But tungod sa infection, mutaas ang energy requirements, mugamay ang food intake, and that would worsen the already existing malnutrition. So in that case, malnutrition is the consequence. So therefore, malnutrition is both the cause and the consequence. And again, it's part of the vicious cycle of malnutrition. Micronutrient deficiencies that affect the immune function include vitamins D, A, C, and the minerals iron and zinc. Usually, kanipod sila ang deficient, no, sa na-ITB. Okay? So, increased energy expenditure, loss of appetite and body weight, okay? Kay inflammation, yapon ni siya, kay tungod kay na-infection man. So, ang atong immune system kay mag-produce og mga compounds that would, increase the basal metabolism. Okay? And that would activate the metabolic pathways leading to wasting protein catabolism, leading to muscle breakdown. So, malabsorption causing diarrhea, loss of fluids and electrolytes. Okay? The energy needs, if gamito na to ang weight-based formula, kani 35 to 40, no? Pero again, if possible ang indirect calorimetry, mao man ang gold standard. So dapat i-estimate na tong energy needs using the indirect calorimetry approach. But if dili, then we must use the Penn University equation or formula. Okay? In pulmonary disorders, guys, if dili possible ang indirect calorimetry, ang atong gamiton daw is the PENU. Kay mauna siya ang result sa studies nga ang pinaka-reliable among predictive-based equations if ang patient is na ay respiratory disease is PENU, the PENU formula. So, it's up to you no to research that, but I believe I've given the formula no in one of the reference materials. So, you just have to review it para makabalo mo unsaon paggamit sa PENU nga formula. Kay mao daw na ang gamiton if ang indirect calorimetry is not possible. Okay. The protein needs is 1.2 to 1.5 grams per kilogram of body weight. Okay, increased yun. Of course, kay naamay muscle wasting, no? Okay. Multivitamin or multi-nutrient supplements might help in order to increase the intake further, no? Because the values that are set in the PDRI might not be adequate no to meet the needs of these patients kay naa na may disease. Okay, and you know that the PDRI values are made for healthy persons. Okay, so pwede ra gyud siya mo increase actually kaning mga nga mga nutrients no pwede gyud nato ni increase way beyond the RNI. Okay, basta di lang siya moabot sa UL. And depende sa assessment if mubo iyahang for example zinc serum zinc level, so kinahanglan gyud nga increase, di ba, iyang zinc intake. So the use of supplements might help, especially if gamay gyud iyang oral intake. Okay. Yeah, and there is this strategy no in hospitals with tuberculosis patients in order to prevent the transmission of the TB pathogen or the bacterium that causes TB in the hospital. So please read the that portion of that topic no in the portion of the book of Ma'am Hamurabo. So nakalimot ko unsa to nga page, but ako lang ibutang diri no kung unsa to nga page. O naa naman mo'y copy sa book ni Ma'am Hamurabo, so ipabasa lang nako to katong regarding sa TB, sa pag-deal with TB patients sa food service nga part. Okay, kay nabi atay concern no nga dapat dili ma-transmit ang kay communicable disease man ni siya. Okay, makahawa man ni. So yeah, even when when dealing with these infectious diseases, dapat protected pud ang other patients as well as the healthcare providers like the R&Ds. Okay, so ako lang ibutang dito ang pages. Okay, the next chronic disease is COPD, which is an umbrella term or a general term for specific diseases. And those specific diseases are emphysema and chronic bronchitis. Sometimes asthma is also classified as a form of COPD. Okay, but not all authors consider asthma under the COPD nga umbrella term. But all of these authors consider emphysema and chronic bronchitis as forms of COPD. Okay, so how do you define these disorders? Emphysema, this is an abnormal permanent enlargement of alveoli accompanied by destruction of their walls without obvious fibrosis. Okay, while chronic bronchitis is chronic productive cough with inflammation of one or more of the bronchi and secondary changes in lung tissues. Okay, so na-enlargement no sa mga alveoli sa emphysema, dili kayo mark ang fibrosis. Okay, while ang chronic bronchitis is unsa man ning fibrosis, this is scarring, di ba? While sa bronchitis usually grabe ang pamaga no, inflammation sa bronchi. That's why it's called bronchitis, because it's inflammation of the bronchi. And naay mga fibrosis na, no, sa lung tissues. Okay? Usually, mauni ang mga characteristics sa mga patients nga naay emphysema or chronic bronchitis. First, sa katong naay emphysema, patients are usually thin, often cachectic, or naay cachexia, no? And usually, those who develop emphysema are older with mild hypoxia and normal hematocrites. While those who have chronic bronchitis, usually they are of normal weight, they are often overweight, and they experience considerable a degree of hypoxia, and they also usually have high hematocrit. Okay? Yeah, mo nitong akong ingon, no, that asthma may also be classified under the COPD. Okay? So, this is how these specific diseases look like. For chronic bronchitis, the bronchioles are inflamed, and you can see here the phlegm or the mucus. Okay? And this is actually the result of the inflammation that is happening in these tubes. Whereas, in emphysema, okay, naay fibrosis, no, naay scarring of the lung tissues and enlarge ang alveoli, and yeah, alveolar damage, no. Okay, usually mudako nga sani naay mga scarring nga mahitabo. Okay, what about asthma? Ang asthma kay inani the normal okay. Another difference sa emphysema o chronic bronchitis is that ang bronchitis, ang inflammation kay naa sa mga bronchioles or even sa katong duha ka bronchi. Diba? That's why it's called bronchitis. Pero sa emphysema, dili kaayo affected ang bronchioles man or ang bronchi. Ang affected is ang the alveoli themselves. Okay? Kaya naay mga scarring dito sa alveoli. Okay. What about bronchial asthma? Katugyapon mga bronchioles ang affected, no? A normal bronchiole looks like this. Dako ang lumen. Okay, dako ang bangag. Okay, then dili inflamed ang wall. As you can see here. But someone who has asthma, grabe ang pamaga sa wall. And nigamay na kaayo ang ang lumen. Then na ay excess mucus nga gaka-produce mauning plema. That's why maglisod ginhawa ang mga asthmatic, no? Okay, tungod kay mugamay manggod ang lumen. Okay? And the difference between bronchitis and asthma is that asthma is triggered by food sensitivities or allergies. Okay? Not all asthma are triggered by allergy, but usually many of the asthma cases are triggered by food sensitivities. So therefore, involve ang immune system ani. This is not a food intolerance issue kay food allergy man ni, food sensitivity man ni. Lahi man ang food sensitivities sa food intolerance, di ba? Nag-explain na nako na last time. So usually, ang mga food triggers sa asthma kay foods with high amounts of sulfites like mga processed meats, seafoods like shrimp, and some herbs. Okay? Ang uban kay chicken, di ba? Okay. So, ang uban eggs. Okay? But again, dili tanan ani no kay associated with allergies. If associated siya sa allergies, then dapat i-restrict na to or i-eliminate yun completely katong mga foods that are known to cause asthmatic episodes in these patients. So we will be able to know that if we use the food and symptom diary, which was introduced to you last time, okay, through the elimination diet, kana siya i-discuss na nato na, next sem, no, kay ang allergies kay next sem pa man. Okay. Provide healthy diet and maintain healthy weight. Be aware of drug nutrient interactions. So these steroids are they suppress the immune response, especially kay ang asthma kay ga-involve sa immune system. So para dili mag hyperactivate ang ang immune system, kinahanglan og kaning mga immunosuppressive drugs like steroids. Okay, usually ang effect ani is muscle wasting, no? So you would have to increase the calories and proteins. Okay. Since many of these patients are cachectic, so the energy needs are high, and the challenge for the R&D is to meet them. Okay, is to make the patients meet the increased energy demand. Okay, so the food intake must be ensured, no, nga ma-match niya ang increased energy needs. Okay, para wala imbalance nga mahitabo and ma-restore ang weight. Okay. Kaning mga headaches and confusion sa kaning mga patients, no, usually tungod na siya sa hypercapnia or excessive carbon dioxide in the blood. Okay? So, mauni siya ang mga gamito nato nga kuan, no, nga approach, no. In estimating the energy needs, of course, indirect calorimetry is the gold standard. But again, if wala, then we can use the PENU formula. Okay. For proteins, increase yun na siya. Okay. To restore lung and muscle strength and promote immune function. Fat is 30 to 45% para mugamay si carbohydrates, para ang RQ, ang respiratory quotient, mugamay. Okay. Maintain na to appropriate RQ. Okay. Address other underlying diseases that may be present. Again, we have to be aware with the food-drug interactions, no. Okay. Kaning list of food-drug interactions, i-discuss pa na nato no sa MNT2, but you can read in advance about this sa katong mga e-books nga ako gipasa, no. Okay, and look for those drugs that are usually used to manage respiratory disorders. So aside from steroids, okay, kaning mga kaning mga immunosuppressive drugs, unsa pa man, mga bronchodilators ginagamit na, okay, para mo dilate si bronchioles ug ma-ease no ang breathing process. Okay. So, see if, they affect the metabolism of nutrients, and assess if there is a need to address those issues. Okay. And vitamins, okay, should at least, or the intake should at least meet the RNIs sa atong PDRI, no? Okay, kaning mga na-emphysema, usually mga smokers ni sila. Okay? So, nganong inani ilang lungs tungod sa smoking. Okay? So, kanang mga smokers, usually magka-emphysema na sila later on. Okay? So, for smokers, the vitamin C should be increased. Maupod ni siya ang question, no? Like, unsang vitamin ang dapat i-increase for smokers? So, the answer is vitamin C. Okay? Increase with siya, like double the RNI. Okay? Mao nitong mga mga drugs, okay, nga ginagamit, like bronchodilators, theophylline and aminophylline. So see if naay mga interactions na with nutrients nga dapat i-address. Okay? Antibiotics. Okay, kung na ay mga infections like TB, okay, or pneumonia. Respiratory therapy and exercise to strengthen muscles. Mao po na, no, i-address po na tong physical activity because if mas active man good ang patient physically, mas mag-improve ang muscle function sa respiratory system. Okay? We also might need the intervention, no, from respiratory therapies, so we can include that under the coordination of nutrition care. Okay, MNT in COPD based on weight or height. Okay. Yeah, kani siya kay at least man lang, no, ma-meet ang 90% of the IBW. Like, for example, nagkakektik siya and unsa tong i-target nga weight at least 90% sa IBW. Of course, you know na how to compute for the IBW or the DBW. So 90% ana mo nang minimum. Okay? For palliative care, like for example, or for hospice care, pwede below 75% of the IBW. Okay. Yeah, naapod issue no sa COPD kay ang GI motility is impaired. Okay? Kani impaired peristalsis secondary to lack of oxygen to the GI tract. Tungod sa hypoxia, no? Okay? So, how do we address this? So, through adequate exercise, fluids, and the exploitation of the function of dietary fiber. So, we can increase the the insoluble fiber kay siya man ang gapa-speed up sa motility sa GI. I-limit na to ang mga foods associated with gas formation para dili mag-bloat ang patient. Kay maglisod na yun na siya sila ginhawa tapos bloated pag yun sila na samot sila kalisod o ginhawa. Diba? We also have to limit aerophagia. When you say what does aerophagia mean? It means ingestion of too much gas. Okay? So, unsa nga mga like dietary behavior nga maka increase og gas ingestion, like kanang mag-chew og gum, di ba, maggamit og straw, di ba, mag-inom og mga carbonated beverages. All of those can introduce a lot of gases to the stomach that would contribute to bloating. So as much as possible, avoid na to nga mga behaviors sa patient. Okay? And we also have to limit those foods that when taken may lead to an increase in gas production, like kaning mga gas producing vegetables, diba? So to counteract fatigue, so resting before meals, eating nutrient dense foods, okay, like very useful na ang kuan ani, no, ang ONS. Kay pwede ra isa ra ka baso ka ONS, daghan na kaayo nga calories ang makuha, daghan na kay proteins nga makuha kaysa sa kanang solid foods nga sometimes di pa sila ganahan magkaon, then daghan-daghan pa. So dili na nila makaon tanan, so dili nila ma-meet ang ilahang calorie as well as nutrient needs. So if maggamit tag ONS as a supplement, so ma-boost na no ang energy and nutrient intake. And that would also mean nga dili sila mag-bloat, no, kay dali ra man na ma-digest ang ONS, di ba? So mao po ng strategy nato para mo increase ang ilang intake, para ma-ensure nato nga ma-intake nila, no, ang required nga mga requirements. Then pwede ta magamit og ONS as supplement. Okay. Okay. Sa atong nutrition counseling, pwede po nato ni incorporate, no? Okay? Kani. Use upright posture to reduce the risk of aspiration. Okay? Okay. Oral supplements mo ito akong ingon, the use of ONS. So kani this is an example of a respiratory patient nga, as you can see, naanay mga subcutaneous fat loss diri, no. Kung i-assess nato ni sa NFPE, this is severe wasting already, no. So severe malnutrition na ni. Okay. Mao ni mga food-drug interactions nga katong ingon nako ganina. Aminoglycosides lower serum magnesium, so may need to replace. So you must ensure, no, sa iyahang intake nga okay iyang magnesium para ma-replenish ng mga nangawala due to the use of this med. Prednisone, this is a steroid drug aside from muscle wasting, which na-address na nimo through increased protein intake. Mao nang ingon niya i-monitor daw ang nitrogen, okay, because the use of prednisone promotes muscle catabolism, okay. You would also have to monitor the calcium levels, kay kaning calcium levels, no, usually mubo tungod sa, especially kung long term na ang use sa prednisone, that is linked with hypocalcemia, so you may need to replace it. The use of prednisone also increases serum glucose due to catabolism, di ba? Mo increase man gud ang gluconeogenesis, mo increase ang glycogenolysis, mo increase, so that would lead to, you know, an increase in glucose levels in the blood, okay. So natural na nga effect sa prednisone, kay kanimang good kay gina-promote man niyang catabolism. So you might need to, you know, unsa man imo ang buhaton para dili magka-hyperglycemia ang patient. So ang GI sa iyahang diet, okay, dapat low. You might also need to reduce the simple sugars, which, you know, given na kay para baya mo gamay ang RQ sa patient, dapat gamay ra ang carbohydrates. Okay. MNT in respiratory failure. So usually nagka-ARDS ang patient or nagka-acute respiratory distress syndrome or acute lung injury. So aspiration of gastric contents or inhalation of toxic substances. Okay. High inspired oxygen drugs, pneumonitis, sepsis, okay. Usually mao ni ang cause sa ALI. Okay, lahi di ay ang ALI sa ARDS, ha. Okay. Aspiration is movement of food. Okay, mo nitong gi-discuss nako. And this can result to aspiration pneumonia. Okay. So, reported incidence of aspiration in tube-fed patients varies from 0.8% to 95%. Clinically significant aspiration is 1 to 4%. Many aspiration events are silent and often involve oropharyngeal secretions. Okay. Symptoms include dyspnea, tachycardia, wheezing, rales, anxiety, agitation, or cyanosis. Cyanosis is kanang excuse me guys. Kaning cyanosis is kana mag-blue bitaw ang appearance sa patient due to hypoxia, di ba? May lead to aspiration pneumonia. ARDS is a manifestation is a form of acute lung injury, and it's the most dangerous manifestation of ALI. Okay? So sepsis usually is the underlying cause, like tungod sa COVID-19, severe viremia, di ba? Increasing pulmonary capillary permeability tungod sa cytokine storm. Pulmonary edema, increased pulmonary vascular resistance, and progressive hypoxemia. So, unsa ato ang treatment, no? Improve oxygen delivery and provide hemodynamic support. Okay? Mechanical ventilation is usually needed. Okay? Okay. Indirect calorimetry is the best tool to determine energy needs in critically ill patients. So, in absence of calorimetry, use predictive equations. So, again, PENU. Dili kanang kuan, Harris Benedict nor Mifflin St. John. So, specifically for lung injuries, for respiratory issues, ang pinaka-the best nga predictive based equations is PENU. Okay? Avoid overfeeding. So, kung available lang RQ, no, so may bawaan man na nato by just seeing the amount of RQ kung overfed ang patient or dili, di ba? You know that already. Okay. Okay. The use of omega-3 fats, which you know is an anti-inflammatory fat, okay, because ang ARDS kay hyperinflammation ba ni siya. So, the supplementation of these anti-inflammatory nutrients as well as antioxidant nutrients have shown improvement in the management of ARDS. Okay. For tuberculosis, okay. Yeah. If naka-oral intake ang patient, small and frequent feedings is our strategy good. It works in many conditions. Bisag pa sa kaning mga respiratory disorders, di ba? Kay para di sila maglisod og ginhawa, para di sila mabusog, mao man gud natong goal. Okay, nga dapat dili sila mag-bloating. So, dapat small and frequent feedings lang, ha? Mao lagi ng katong sa laboratory ninyo, katong nag-prepare mo og mga therapeutic meals, naa dito nag-GERD diet, naa dito low GI diet, nga daghan kayo pagkaon sa isa ka meal, which is dili pwede, especially sa mga patient nga nay inani, kay dali ra na sila mabusog. Kung ipakaon ani mo tanan sa ilaha, mudako ilang tiyan, no, then mas maglisod sila ginhawa. Okay, so mao nang in planning their meals, dapat gagmay pero kanunay. That's small and frequent feedings. Okay, kanapod mga foods nga minimal lang ang chewing para dili kayo maka-introduce og daghan nga gas para ma-decrease ang aerophagia. Okay, the use of ONS is encouraged good. Okay, especially sa katong mga patients nga dali ra mabusog. Okay, okay, for pneumonia, okay. Basahon lang ninyo ni guys kay tanan ni siya kay na-discuss na gyud nako. Basahan na lang ninyo, ha. Okay. Sige, maura gyapon na sila. Okay, aside from this reference material for this chapter na apod ko gi-upload nga basahonon ninyo, no. This is nutrition in pulmonary disease. So, actually kung unsay content diri, maura diri, no. Okay, unsay bottom line ato, maura gyapon diri, but I would like you to read this on your own, no. Okay, kay para dili lang mo sige paminaw sa ako, dapat ang inyong reading skills pud kay ma-improve. So basa pud mo ani, pero dali na lang ninyo ni masabtan kay most of this kay na-discuss na yun nato yun. Okay, o kaning mga aerophagia, okay, kaning important sa pag-deal with cachexia kay kaning mga patients kay usually cachectic. Okay, describe the metabolic changes caused by pulmonary disease and cachexia. Katulad gyapon to, inflammation that would lead to malnutrition. Okay, basahan ninyo. Okay, basahan ninyo ni. And ay mga case studies, so you also have to try this na on your own, like matubag ba ninyo ni. Okay, so one way po to assess whether you have learned something or not, try mo ka ng answer ani. Okay, okay, diri itong mga drugs, no, that are commonly used to treat pulmonary diseases. So na ay mga nutritional implications diri, such that for example mag-take mo bronchodilators, usually mugamay ang appetite tungod side effects sa drug, okay, may cause taste changes, nausea or dyspepsia. So that you would be informed, no, nga ay tungod siguro na siya sa use of these drugs nga nung nauseated ang patient or kaka-experience siya dyspepsia. So para kabalo mo sa inyong intervention ani. Okay. 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 Indirect calorimetry is the gold standard for determining energy requirements. When unavailable, the Penn state equation should be used. Mo nitong akong ingon. Okay? Because carbon dioxide is a byproduct of energy substrate metabolism, it is important to avoid overfeeding. Okay. Na, diba? Tanan nga mga points ani kanya discuss na nato. Okay? Prolonged mechanical ventilation in conjunction with the inflammatory cascade cast by ARDS puts patient at risk for lean body mass catabolism or protein catabolism, including that of the diaphragm and other respiratory muscles, which would worsen the condition. Okay. Also, pwede sad mo maghuna-hunaan like kani round table discussion, mao ni ang problem. Okay. So mag-recommend batag weight loss sa COD patient nga obese. Okay? So you should be able to answer this, no? But first basahon sa ninyo ning mga naa diri. Okay? Yeah. Optimal macronutrient content of enteral feeding in COPD. Okay? Most of this kay na discuss na ako sa COVID-19 nga MNT, no. Immunonutrition, okay, unsa tong mga anti-inflammatory nutrients and katong mga antioxidant nutrients that might be helpful. So naa diri, no, micronutrients, antioxidants, okay. Yeah. Kani about vitamin D, magnesium, phosphorus, basahan ninyo ni, ha. And naa diri, no, about the use of megestrol acetate. So unsa ni siya, ha? Okay, kamo basa ani. And the effect of beta hydroxy beta methylbutyrate or HMB on the protein muscle mass. Okay? So unsa ba ni siya? Helpful ba ni siya or dili sa preserving the lean body mass? So basahan ninyo ni. Okay? So I think that's it. So after you're done with this, then you are now ready to answer the NCP for pulmonary disease, which is already given here. And yeah, that's the end of the coverage for your 4th chapter exam. Okay? Ang coverage is lower GIT disorders and respiratory disorders. Okay? So I guess that's it. So yeah, I'll see you on the open forum. No? Thank you.